Isn't it strange how sometimes the most important messages from our bodies whisper instead of shout? We get aches and pains as the years go by, little creaks and groans we learn to live with, or maybe put down to just getting older. And for the most part, that's perfectly normal, isn't it? But sometimes, that little whisper isn't just age catching up. Sometimes, it's something much more serious. Something related to the very center of everything, your heart. It's a painful reality that as we move into our 60s and beyond, our hearts have been working tirelessly for a long, long time. They've pumped blood for decades, carrying us through life's ups and downs. And while they're incredibly resilient, they can face challenges. What's tricky is that the signs of trouble aren't always like they show in the movies. That sudden, crushing chest pain, especially after 60 heart problems, can show up in really unexpected, almost strange ways. Symptoms you might easily mistake for something else entirely. You might think it's just a touch of indigestion or slept funny or just feeling run down. The secret is knowing what those strange whispers might actually mean. In this video, we're going to look at 6 of these surprising and often overlooked symptoms that could be telling you your heart needs a little extra attention. These are things that many people, even doctors sometimes initially, might not immediately connect to the heart, but being aware of them, really listening to your body when these unusual things pop up, can make a world of difference. It's about giving yourself the best chance to catch something early, to understand what's happening so you can take care of yourself. Watch to the end for something that will surprise you. Let's start with the first of these strange symptoms, one that many of us are familiar with, but in a way that feels different. And that's unusual fatigue or exhaustion. Now, feeling tired isn't exactly strange. Right. As we get older, we often feel less energetic than we used to. Maybe we need a nap in the afternoon, or we don't bounce back from a busy day as quickly. That's pretty common. But the kind of fatigue I'm talking about, the kind that can be a warning sign for your heart, is different. It's a profound exhaustion that doesn't seem to have a clear reason. It's not just feeling a bit weary, it's feeling absolutely wiped out. Even after a good night's sleep, it's a level of tiredness that makes simple, everyday tasks feel incredibly difficult, almost monumental. Think about something you normally do without a second thought, maybe walking to the corner shop, or doing a little bit of gardening, or even just making breakfast. If suddenly, those things leave you feeling completely drained, like you've run a marathon, even though you haven't done anything strenuous, that's the kind of fatigue that raises a flag. Why would tiredness be a sign of heart trouble? Well, your heart's main job is to pump oxygen-rich blood around your body to fuel your muscles and organs. If the heart isn't pumping as effectively as it should, it can't deliver enough oxygen to where it's needed. Your body, in response, conserves energy. It feels like everything requires immense effort because your cells aren't getting the fuel they need. This isn't just a mental tiredness or feeling bored. It's a physical depletion that's hard to shake off. People describe it as feeling weak, heavy, or just utterly incapable of doing things they normally do. Imagine trying to walk up a gentle slope that you've walked hundreds of times before, and suddenly, you feel like your legs are made of lead and your whole body is protesting. Or maybe you find yourself having to sit down and rest halfway through getting dressed in the morning. It's that kind of inexplicable, overwhelming fatigue that goes beyond just needing a rest. What makes this symptom particularly strange and often missed is that it can be easily attributed to so many other things common in later life stress. Poor sleep, other health conditions, side effects from medication, or even just assuming this is what getting old feels like. You might think, oh, I just didn't sleep well, or I overdid it yesterday, or must be that cold I'm fighting off. And sometimes it is. But when this extreme fatigue is persistent, when it doesn't get better with rest, and when it starts to impact your ability to do daily activities, it's crucial to consider the possibility that your heart might be involved. It's your body telling you it's struggling to keep up with even basic demands. Paying attention to the degree of fatigue and how it contrasts with your usual energy levels is key here. Don't just dismiss it as old age. Now, let's talk about another symptom that feels strange because it often shows up when you're not doing anything or doing very little. This is shortness of breath, especially when you're resting or lying flat. Again, shortness of breath during strenuous activity might seem more obvious, though even that can be more significant than people realize as they age. But finding it hard to breathe when you're just sitting down, watching TV, or even worse, when you're trying to sleep at night, that feels wrong, doesn't it? This kind of breathlessness, particularly at night, is a classic strange symptom. You might wake up suddenly feeling like you can't catch your breath, needing to sit up or even stand by an open window to feel better. Or maybe you notice that you need more pillows to prop yourself up at night because lying flat makes you feel like you're suffocating or drowning. This is called orthopnea, and it's a strong indicator that something might be going on with your heart's ability to handle fluid. When your heart isn't pumping efficiently, blood can back up in the veins leading away from the lungs. This causes fluid to leak into the lung tissue, making it harder for oxygen to get into your bloodstream. When you lie flat, this fluid can distribute more evenly across your lungs, making the breathlessness worse. Sitting or standing allows gravity to pull some of that fluid downwards, providing some relief. Think about it like this: if your heart is a pump pushing water through a system, and the pump is weakening, water starts to back up. If that backup affects the pipes leading to your lungs, fluid collects there. It's a really uncomfortable, frightening feeling. What makes this strange is that people might attribute it to asthma, bronchitis, or just being out of shape. And while those are possibilities, persistent shortness of breath, especially the kind that wakes you up at night or requires you to sleep sitting up, is a major warning sign that needs immediate medical attention. It's your body showing you that fluid is pooling because the pump isn't working effectively. Imagine being unable to lie down comfortably in your own bed because breathing feels like a struggle. That's a significant change and not something to ignore. It's a symptom that forces you to change your behavior just to be comfortable. A clear signal that something fundamental is off. Paying attention to when you feel breathless. Is it only when you exercise? Or is it happening at rest? Or when you lie down? Is crucial for understanding its potential cause. It's not just about feeling winded after climbing stairs. It's about feeling winded doing almost nothing. Moving on from feeling tired all the time and struggling to breathe when lying down. Another thing many people might dismiss as just a result of standing too much or getting older is swelling, particularly in the legs, ankles, and feet. This is known as edema. And while it has many causes, it can be a strange and subtle sign that your heart is having difficulty. Most of us might notice our feet and ankles swell a little if we've been on our feet all day, or if it's a hot day. But this swelling related to heart issues is often more persistent and noticeable. You might see that your socks leave deep indentations around your ankles even after you've taken them off. Your shoes might feel tighter than usual by the end of the day, or even feel snug first thing in the morning. The swelling might extend up into your calves or even your thighs. When you press on the swollen area with your finger, it might leave a lasting indentation, like pressing into dough. This is called pitting edema. Again, why would swollen ankles mean heart trouble? It goes back to the heart's pumping action. If the heart isn't pumping strongly enough, blood flow can slow down in the veins in the legs. This increased pressure in the veins causes fluid to be pushed out into the surrounding tissues, especially in the lower extremities because of gravity. The kidneys might also respond to poor blood flow by holding on to more salt and water, adding to the problem. So, while you might blame it on standing or sitting too long, or even just a sprained ankle you forgot about, persistent, noticeable swelling that doesn't resolve easily can be a sign that your body is retaining fluid because your heart isn't managing circulation effectively. What makes this strange is how easily it's overlooked or attributed to less serious causes. Someone might just buy wider shoes or loosen their shoelaces, thinking it's a circulation issue related to age, or maybe they have a desk job, or they think it's connected to a vein problem, and sometimes it is. But if the swelling is bilateral in both legs, doesn't go away overnight, and is accompanied by other symptoms like the fatigue or breathlessness we talked about, it's a strong indicator that your heart could be struggling. Imagine not being able to wear your favorite pair of shoes because your feet are constantly swollen, or seeing those deep marks from your socks night after night. That's your body giving you a subtle but important message. It's a physical manifestation of fluid imbalance, often linked to the heart's reduced efficiency as a pump. Don't just accept it as part of getting old without getting it checked out. It's not just cosmetic. It can be a clue to what's happening internally. Now, let's talk about a symptom that is incredibly common and almost always blamed on something you ate: persistent indigestion or nausea. We all get indigestion from time to time, especially after a rich meal or if we eat too fast. But sometimes, indigestion, stomach discomfort, or a feeling of nausea, especially when it's not clearly linked to food, can be a strange sign of heart trouble, particularly in women and older adults. This isn't your typical heartburn that gets better with an antacid. This is more of a general feeling of unease in the stomach, pressure, fullness, or even nausea that might come and go. And it might even worsen with physical activity. You might feel sick to your stomach during exertion, or experience persistent discomfort high up in your abdomen that feels more like pressure than burning acid. It can be easily mistaken for a gallbladder issue, a stomach bug, or just chronic indigestion. Why is this strange? Because we instinctively connect heart problems to the chest, but the nerves from the heart share pathways with nerves from the stomach and digestive system. So, when the heart is in distress, the brain can sometimes interpret those signals as coming from the stomach area. It's a form of referred pain or discomfort. Think of it like the brain getting its wires crossed. The signal is coming from the heart, but the brain tells you your stomach is the problem. This can be incredibly misleading. Someone might take antacids, avoid certain foods, or even get tests for digestive issues, completely missing the fact that the problem originates in their chest. Imagine feeling nauseous or having a strange, heavy feeling in your stomach when you're trying to walk up a flight of stairs, and that feeling goes away when you rest. That's a strong clue that it might be related to activity and blood flow, which points towards the heart, rather than a bug or something you ate. Or perhaps you have a persistent, mild nausea that just never seems to go away, even though you haven't changed your diet. This subtle, ongoing discomfort can be your heart's way of signaling distress. What makes this symptom so dangerous is how common digestive complaints are after 60. It's so easy to just wave it away as my stomach acting up. But if this stomach discomfort or nausea is unusual for you, persistent, or occurs during physical activity, it's definitely worth mentioning to your doctor, even if it seems unrelated to your heart at first glance. Don't assume it's just heartburn or a bad meal. It could be a crucial warning from your cardiovascular system. Next, we'll dive into another type of discomfort that often gets mislabeled: pain or discomfort in areas you wouldn't typically think of for a heart issue, like the jaw, neck, back, or arms. Next up in our list of strange symptoms are aches and pains that show up in places you might not immediately associate with your heart at all. We often hear about chest pain, maybe pain radiating down the left arm during a heart attack, but heart problems, especially less acute issues or different types of heart conditions, can cause discomfort in the jaw, the neck, the upper back, or both arms, not just the left one. This pain or discomfort might not be sharp or severe like typical angina. It can be a dull ache, a feeling of pressure, tightness, or just general discomfort. Why is this strange and often missed? Because these are common areas for other issues after 60: arthritis, muscle strain, pinched nerves, Even dental problems or tension headaches can cause pain in the jaw or neck. Back pain is almost a universal experience. So, if you wake up with an ache in your shoulder blade or feel a tightness in your jaw, your first thought is probably not, "my heart." And that's why it's such a strange and dangerous symptom. It perfectly mimics so many other benign conditions. This is another example of referred pain, where nerve signals from the heart are misinterpreted by the brain, making you feel pain somewhere else. Imagine the complex network of nerves in your body. When the heart is under stress or not getting enough oxygen, like during angina, it sends pain signals. These signals can travel along nerve pathways that are shared with nerves from other parts of your upper body: the jaw, neck, shoulders, arms, and upper back. So, your brain might attribute the signal to the structures those other nerves serve. For instance, pain originating from the lower part of the heart muscle is more likely to be felt in the abdomen or back, while pain from the upper part might be felt in the jaw or neck. The key thing to pay attention to here is the context of the pain. Does the discomfort in your jaw or arm come on when you're exerting yourself and go away when you rest? Does the ache in your upper back seem unrelated to movement or posture? Is it accompanied by any of the other strange symptoms we've discussed, like unusual fatigue or shortness of breath? Someone might dismiss a recurring tightness in their neck as needing a massage, or a dull ache between their shoulder blades as bad posture. But if these symptoms are new, persistent, or related to physical activity, they warrant investigation. It's your body telling you there might be a problem upstream, originating from the heart. Even though the sensation is showing up downstream in your jaw or back, don't assume all aches are just muscle soreness or arthritis, especially if they have an unusual pattern or coincide with exertion. Finally, let's consider a symptom that can be quite unsettling and is often attributed to low blood sugar, dehydration, or just standing up too fast, dizziness, or lightheadedness, sometimes even leading to fainting. Feeling a bit wobbly or dizzy happens to many people, especially if they haven't eaten, are feeling unwell, or get up too quickly. But frequent or severe dizziness and lightheadedness, or actual fainting spells, syncope, can be a strange and serious sign that your heart isn't pumping enough blood to your brain. Why is this strange? Because again, we don't always connect feeling dizzy to the heart. We might think it's a neurological issue, a balance problem with the inner ear, or something related to blood pressure. Though blood pressure is closely linked to heart function, of course, but if the heart isn't pumping strongly enough, or if there's a problem with the heart's rhythm, the amount of blood reaching the brain can momentarily drop. This lack of sufficient oxygen and nutrients to the brain causes that feeling of lightheadedness, disorientation, or even a complete loss of consciousness. Imagine standing up from a chair and everything going momentarily black, or feeling so unsteady on your feet that you have to grab onto something to avoid falling. These sensations aren't just inconvenient, they can be indicators that your brain isn't getting the consistent blood supply it needs. This could be due to the heart pumping too weakly, or perhaps beating too fast, too slow, or irregularly, an arrhythmia, which disrupts normal blood flow. Sometimes, these dizzy spells happen when the heart is under stress, like during exercise, or when you change position rapidly. What makes this symptom particularly strange and dangerous is that it can be intermittent. You might feel dizzy one moment and fine the next, making it easy to dismiss or forget about. Or you might attribute it to being a bit dehydrated or tired. But recurring episodes of dizziness, lightheadedness, or near fainting spells are your body's way of saying, "Hey, the supply line to the brain is faltering." It requires investigation to figure out why the blood flow is being compromised, and heart issues are a significant potential cause that needs to be ruled out. Don't just brush off feeling dizzy regularly. It could be a sign that your heart's rhythm or pumping function needs evaluation. It's a strange feeling, but it's one that demands your attention. So, we've talked about these 6 strange symptoms. the overwhelming fatigue that doesn't go away, the breathlessness that hits you when you're trying to sleep, the swelling in your legs that isn't just from standing, the persistent tummy troubles that feel like indigestion, the unexplained aches in your jaw, neck, back, or arms, and the unsettling spells of dizziness or lightheadedness. The surprise, perhaps, is how ordinary some of these symptoms seem on their own. How easily they can be mistaken for the everyday complaints of getting older, or for completely unrelated issues. That's why they're so dangerous. They don't always scream heart problem. But when you put them together, or when you notice them as new, unusual, persistent, or occurring during exertion, they tell a potentially vital story. Remember, you know your body best. You know what feels normal for you and what feels off. Don't let the fact that these symptoms aren't the classic chest-clutching scenario prevent you from seeking help. Being aware of these strange possibilities is the first step. Listening to your body's whispers, even the ones that sound like something else entirely, is crucial. It's not about panicking every time you feel a bit tired or have indigestion. It's about paying attention to patterns, to changes, and to the context in which these symptoms appear. If you experience any of these strange symptoms, especially if they are new, worsening, or happening together, the most important thing you can do is talk to your doctor. Describe exactly what you're feeling, when it happens, and how long it lasts. Your doctor can evaluate your specific situation, consider your overall health and history, and determine if these symptoms might be related to your heart or something else. Getting a proper diagnosis is key to getting the right care. Remember, knowledge is power. Understanding these subtle, sometimes strange signs empowers you to be your own health advocate. Taking care of your heart after 60 is about more than just avoiding the obvious risk factors. It's about being attuned to its language, even when it speaks in unexpected ways. Making small changes, like staying active, eating well, managing stress, and getting regular checkups, all contribute to a healthy heart. But perhaps the most critical habit is simply listening. Listening to your body, trusting your instincts when something doesn't feel right, and seeking medical advice when needed. We are all living longer, more vibrant lives, and we want to do so with strong, healthy hearts. Don't dismiss strange or unusual symptoms as just part of aging. They could be important messages you need to hear. We hope this information has been helpful and shed some light on these often missed symptoms. If you found this video useful, please give it a like. It really helps us reach more people who might need this information, and we'd love to hear from you in the comments below. Have you experienced any of these strange symptoms? What helped you understand what was happening? Sharing your experience might help someone else who is going through something similar. Don't forget to subscribe to our channel for more videos aimed at helping you live your best, healthiest life at every age. We cover all sorts of topics related to health, wellness, and thriving after 60. Thank you for watching. And remember to listen to your body, take care of yourself, and live your best life at every age.